Join me as I dive into the complex world of ITP and take on the challenge of explaining how anti-RhD works, all while keeping it simple and relatable. Idiopathic Thrombocytopenic Purpura, or ITP for short, is a chronic autoimmune disorder that affects the blood. In simple terms, it's a condition where your body mistakenly attacks and destroys its own platelets, leading to a low platelet count. This can cause bruising, bleeding, and petechiae, which are tiny red or purple spots on the skin. Living with ITP can be incredibly challenging. For one, having a low platelet count puts you at risk of internal bleeding, which can be life-threatening. Even minor injuries can cause significant bleeding, and in severe cases, it can lead to bleeding in the brain or other vital organs. Furthermore, the constant fear of bleeding can be emotionally draining, affecting daily life and relationships. Additionally, the uncertainty surrounding ITP can be frustrating, as it's difficult to predict when platelet counts will drop. This unpredictability can make it hard to plan daily activities or make long-term decisions. Lastly, the emotional toll of living with a chronic illness should not be underestimated, as it can lead to anxiety, depression, and feelings of isolation. Moreover, ITP can also lead to complications during surgery or invasive medical procedures. It's essential to have a solid understanding of one's platelet count before undergoing any treatment. In some cases, ITP can be misdiagnosed or mistaken for other conditions, which can lead to unnecessary treatments or delays in receiving proper care. The lack of awareness and understanding surrounding ITP can be a significant obstacle for individuals living with the condition. In addition to these challenges, women with ITP may experience heavier menstrual periods, which can be physically and emotionally exhausting. In rare cases, ITP can also increase the risk of pregnancy complications, highlighting the need for close monitoring and care during pregnancy. So, how does anti-RhD immunoglobulin fit into the picture? Well, it's a medication that's been proven to be highly effective in treating ITP. Essentially, anti-RhD works by masking the platelets in your body, making it difficult for your immune system to identify and attack them. This allows your platelet count to increase, reducing the risk of bleeding and bruising. The science behind it is fascinating. When anti-RhD is administered, it binds to the RhD antigen on the surface of red blood cells, making them a target for the immune system instead of the platelets. This clever trick allows your body to focus on eliminating the anti-RhD-coated red blood cells, leaving your precious platelets untouched. Studies have shown that anti-RhD is most effective in individuals with ITP who have not responded to other treatments, such as steroids or IVIG. In these cases, anti-RhD can be a game changer, providing a much-needed increase in platelet count and reducing the risk of bleeding. The mechanism of action is complex, but the end result is clear. Anti-RhD has been shown to improve the quality of life for individuals living with ITP. One compelling case study that showcases the power of anti-RhD is that of a young woman who had been living with ITP for several years. Despite trying various treatments, her platelet count remained stubbornly low, and she experienced frequent bleeding episodes. However, after receiving anti-RhD, her platelet count skyrocketed, and she was able to resume normal activities without fear of bleeding. This breakthrough moment in her treatment was a turning point, allowing her to regain control over her life and plan for the future with confidence. There are many more stories like this, where anti-RhD has made a significant difference in the lives of individuals with ITP. By understanding how this medication works, we can better appreciate its importance in managing this complex condition. In summary, ITP is a challenging condition that requires a deep understanding of its complexities, and anti-RhD is a vital tool in treating it. By grasping how anti-RhD works, we can better appreciate its significance in improving the lives of individuals with ITP. Thanks for watching. If you or someone you know is living with ITP, I'd love to hear your thoughts in the comments below. Share your experiences, ask questions, or simply let me know what you'd like to learn more about in future videos. And don't forget to check out another video on related blood disorders. The more we understand, the more empowered we become.